Hi, and welcome to Understanding Addiction Part 3. In this section, we're going to talk about defining addiction. What is addiction? How do you know if you have an addiction versus just social or recreational use or engagement in an activity? So, we'll start with some very simple definitions. The addiction becomes your best friend. You turn to your addiction when you're stressed, when you're depressed, when you're happy. You go to that activity. The preoccupation or obsession with the addiction interferes with other areas of your life. So, maybe when you're stressed, and I know a lot of people do this. They come home from work, or maybe after work, they stop at a local bar, have a few drinks to help unwind because they had a stressful day. Does that make them an addict? Not necessarily. If it's not causing problems in other areas of their life, and that includes financial, health, relationships, everything like that. But if it's not causing problems in those areas of their life, then it's probably still just recreational use. If they start having problems in those areas and they cut back on their use, again, not a problem. It's when you continue to use despite the fact that it's causing problems in other areas of your life. Now, we can talk about behavioral addictions as well as drug, alcohol, those sorts of things. Alcohol addiction, when you start using, you start spending more than you intended, you drink more than you intended, you spend longer at the bar than you intended, you have blackouts, you start having health problems, relationship problems, financial problems, legal problems. You see where I'm going with this. Drug and alcohol addictions are a little bit easier to identify as problematic addictions than some other things like gambling, sex, shopping, relationships. The principles are the same. Whatever this is, this person, this activity, it's your go-to. When you're happy, when you're sad, when you're stressed, when you're depressed, when you're lonely, and you're thinking about it all the time, you're engaging in it so much that it's starting to interfere with other areas of your life. You're foregoing hobbies. You are not interacting with your other friends. You are withdrawing. You are not feeling any better, which, in and of itself is a problem. So, keeping that in mind, remember most people have a primary addiction, their go-to, but if they can't get to their go-to, they have a secondary, and maybe even a tertiary, and a fourth. I don't know what area that is, but anyway. Think about all the behaviors you use to escape from negative feelings. Not the things that you do that help fix it, but to escape, and this can include sex addiction, exercise addiction, food addiction. There's lots of things we can be addicted to. If it makes the pain go away, it's possible to be addicted to it. So, have you used more than you intended, spent more money than intended, or spent more time than intended engaging in this behavior? So think about over the last 6 months with each one of your addictive behaviors. And remember, we have a lot of them. Most of us don't just pick one and stick with it. We have a lot of different sort of obsessive addictive behaviors. You spent more time doing it. Maybe that was on the internet. Maybe that was shopping. Maybe that was sex. Whatever it is for you. Spent more money than intended. Maybe, maybe not. But we're talking about looking at excessive problems caused by this addiction, caused by this behavior. Or spent more time than intended engaging in this behavior. And when we talk about sex addiction and relationships, this is where the time factor comes in. If you're obsessed with that person, spending a bunch of time skipping work for that person, those sorts of things, we might start to look and say, is this a problem? I've been unsuccessful at stopping or significantly reducing my use of this behavior. So, if you've tried to stop drinking, stop using drugs, stop having sex as much, stop having shopping binges, whatever it is that you're looking at, have you been successful? Have you said, okay, I am not going to do this for 24 hours or 48 hours or whatever number you set? Were you successful? If so, then you might not have a problem. Now that people kind of skate on this one because we have people who can get along most of the time But then when the going gets tough, they just go down this rabbit hole and they can't get out of it because they cope with their addiction. They cope by using an addiction. So what we want to look at is, have you significantly reduced it even in the face of stress? Think about over the last 6 months. Anytime you've been really, really stressed, have you always gone to your addiction, or have you said, no, I'd really like a drink right now, but the best thing for me is to go to the gym, or to, for me, I go outside and I whack bushes. I get a power tool and I'm good to go. But what you want to look at is, how are you coping with life and on life's terms? Has your tolerance increased, needing more of the same substance or activity, or started combining substances or activities to get the same high? When we talk about drugs and alcohol, again, that's easier to look at and go, okay, I used to just drink. Now I drink and use cocaine. Or now I drink and use Xanax, or whatever your mixture happens to be. And those are not good mixtures, by the way. Have you needed that in order to get the same high? Have you needed to drink more? Instead of having 1 or 2 beers, are you needing to have 10 or 12 beers? When we're talking about gambling, do you need to spend more money? Is a $20 bet no longer going to do anything for you? It needs to be a $200 bet. Again, think about over the past 6 months. What is it? Has the threshold for this behavior gone up? You need more of it in order to help you feel good. In recovery, we call this chasing the high. You're chasing that feeling you had the first time you used it and you said, oh yeah, this is it. I want to do this again. I've engaged in risky behaviors to get the substance, engage in the activity, or increase the rush. Shoplifting. Again, drugs and alcohol, there are lots of risky behaviors you can engage in. Maybe even mixing drugs that aren't, good and well, are not supposed to be combined because they can be dangerous. There are a lot of different things people will do, using in public places, skipping work, taking more chances. Have you done any of these? And has that increased your thrill with using? One of the things we look at when we talk about behavioral addictions is there a rush to getting away with something? Have you spent more time than intended thinking about using, planning to use, using, or recovering? So if you're sitting at work all day going, oh, I cannot wait to go to the bar. Where am I going to go? Who am I going to go with? Who has the best things that we can eat during happy hour? Instead of doing your job, that might be a problem. Okay, if you're spending a lot of time thinking about where to get your substance, who to get it from, what you're going to do, if we're talking about relationship addiction, if you're spending a lot of time obsessing about what is that person doing, are they being faithful, do I need to call them, is the world going to end if they go away? That could be a problem. Planning to use kind of goes into what I just talked about. Using, spending time with the substance or activity, and recovering from it. Now, we know about recovering from blackouts and hangovers, but let's talk about recovering from some of those behavioral addictions. If you are exercise addicted, you can exercise too much. You can cause your body to start having a lot of problems. So having to recover from this behavior, are your recovery periods getting longer? You're giving yourself stress fractures. You're giving yourself knee and hip problems. This might be what we call a clue that you're overdoing it. And it's starting to impact your health. It kind of goes against the notion of I'm going to the gym to exercise and do something good for me, but too much of a good thing. Anything can be too much. Let's look at some other behaviors. Recovering from gambling. Well, part of it may be recovering from staying up all night or whatever you're doing, but part of it is recovering financially from any losses that you may have experienced. So when we talk about recovering, we're talking about getting back to the status quo emotionally, mentally, socially, financially, environmentally, all those things. Getting back to where you were before you started using. So again, over the last 6 months, Have you spent more time than intended on these things? Spending more time engaging in the behavior and less time with friends, family, and schoolwork activities or pursuing other interests. If this is all you do, it might be a problem. There was a game at one point called World of Warcraft that ended many, many marriages. People would get into that game and they literally would not even get up to go to the bathroom. They would have jars and we all make choices, but that leads you into an addictive behavior. They were getting so preoccupied, so involved in this game, that it was becoming a preoccupation and possibly an addiction. Now, when we look at addiction, we also want to look at the reasons for use, but you kind of get my point here. If all you can think about is using, and then when you're using, you're happy, and then when you're recovering, all you can think about is recovering and using again, that's a problem. Have you experienced emotional or physical issues because of using or withdrawing from use? Now, normally we talk about physical withdrawals. Sweats, tremors, vomiting, high blood pressure, lots of physical stuff. Obviously, those are going to be more prominent with alcohol and drug addiction. However, these behavioral addictions like gambling, sex, relationships, eating, exercise, when you take that away, this addiction is how you've been coping with stress, anxiety, depression, a whole myriad of not pleasant feelings. When you take that away, guess what? People get anxious. And when people get anxious, they have a racing heart rate. They may have panic attacks. They may have depression. They may have difficulty sleeping, loss of appetite, all kinds of things, physical symptoms of stress. These are withdrawal symptoms. These are psychological withdrawal symptoms. There is nothing that withdrawing from binge eating or withdrawing from running is going to do that's going to physically cause you to have withdrawals. However, psychologically, the anxiety and or the depression may ramp up. The resentment at your body kind of going against you if you're having to quit or lay off of exercise because you've gotten an injury. So again, think about the last 6 months. Has your use, have you tried to stop and the stopping was just so painful, so miserable, that you went back to it? Again, remember, if you're addicted to one thing and stop doing it without addressing whatever's causing this misery, physical pain, emotional pain, grief, anger, whatever you want to label it, you're going to choose another addiction. If you didn't have the tools to deal with it, and you turn to the addiction in order to numb the pain until you could get the tools, and you take away the addiction, but you haven't gotten any new tools, guess what? You're no better off than you were. So am I saying keep using your addiction? No. I'm saying get some new tools. Let's go shopping. One of the best things about recovery is that you start to feel things again. And one of the worst things about recovery is that you start to feel things again. And it can suck. We're going to talk in later episodes about riding the wave, about not having to act on every feeling. One of the things we need to do is learn how to tolerate our own emotions. Because with addiction, as soon as we started to feel something, what did we do? Numbed it out because it was just too overwhelming. As you start to feel things again, you're going to have to start to learn how to feel. And initially, it's going to hurt or be overwhelming or be exhausting or all of the above. So you need to have some stopgaps in place, somebody to help you do what we call riding the wave. So you can hurt without having to engage in your addiction. Call your sponsor, have a friend. Figure out 3 or 4 things that you can do when you're just kind of at your wit's end, when you're really craving your addiction. Figure out 3 or 4 things that you can do instead of it. That will help get you through that 10 or 15 minute period where you're like, I don't know if I can deal with this. So the next thing we want to do is look at the reasons for use. Because remember I said if You take away the addiction and you haven't addressed all the reasons that you're using, you're going to be in a bad place. Well, first we've got to figure out the reasons you're using to figure out which tools to get. Look at the list, rewarding yourself, relaxing as a social activity, to avoid feeling withdrawals, to help you be romantic, to help you feel less sad, boredom, peer pressure, to help you get through something unpleasant, or just to help you sleep. Those are only some of the reasons. I wanted to give you an idea to prompt you, but one of the things I want you to do is brainstorm. Think back over the last 6 months when you've used your addiction. Why have you used it? Sometimes it's just habit. You always go to the bar after work. You always do this. So we need to break that habit. But we also need to look at other reasons. What's causing this pain or turmoil or anxiety? When you're starting to see the impact your addiction has had on you over the last few months or years, you're going to start to get motivated to take the next step to change it. Right now, you're starting to understand the functions that your addiction serves, and it did serve a purpose. A huge part of your recovery is going to be finding alternate ways to meet those same needs. I'll see you on the next episode. Thank you.